Halberstadt. Could you talk to us a little bit about obsessive compulsive disorder and your approach?
These are people who have tremendous anxiety. Something terrible is going to happen to them. And they have to set up ritualistic behavior to keep something from happening. It's magical thinking. If I count so much, nothing terrible is going to happen to me. And sometimes one has a fear something's going to happen to someone else, and they can prevent it by their own ritualistic behavior. For example, someone may fear that if I don't complete a circle with my car, one of my friends is going to die. So what's common to all these disorders is the fear of death and harm, either to themselves or to other people, and they result to ritualistic behavior, which is magical thinking, to keep it from happening, like counting to 30. If you count to 30, this event's not going to happen. What I do, I address why the people feel so threatened. That has to be resolved if they're going to give up this fear.
And so hypnosis, would that ever play a role, or medication?
Medication may be helpful by dampening the anxiety, and that can be helpful, but still you have to address the issues why the person is so frightened.
Beyond the root cause? Or
yes, and we have to get why a person is so threatened. You have to get early events in the life that make the person feel so vulnerable for himself or herself, or to others whom they relate to.
So someone could expect to just sit down and talk during a first session?
Well, partners talking, to address a problem, you have to understand what the problem is. To address why you're so anxious, you have to address the reasons why you're so anxious. You have to understand it. You have to understand before you can give up those beliefs. It's a struggle, but it can be done. I've had patients resolve their disorders.
Terrific, Doctor. Thank you for discussing this important issue. And if someone did want to get in touch with you and talk further, how would they do that?
My phone number is 248-457-9667.
And the all-important insurance question?
Insurance covers it.
And you take most insurance?
I take most insurance.
Great, Doc. Thanks so much. And until our next installment, good night.